Welcome back to MSNBC Live. I'm Carlos Watson. Now, there's dissension in the ranks of Congress and among its leaders. The Speaker of the House says Democrats remain on track to get health care passed before the August recess. But guess what? Her second-in-command says that members may leave without even voting. With me now live is Democratic Congresswoman Debbie Wasserman Schultz from Florida, from South Florida, in fact, where I'm from. Congresswoman Wasserman Schultz, good to see you.
Good to see you too, Carlos.
So what are we to believe? Are we to believe Speaker Pelosi, or should we listen to Majority Leader Steny Hoyer? Are people going to meet the president's deadline and get something passed and out before the August recess, or what?
Well, I'm not quite sure where you heard that Leader Hoyer is thinking we may not vote. I just came from his office, and we're very much on track to vote next week. We're working diligently towards making sure that we have a comprehensive understanding of the proposed legislation. Want to make sure that we can cover all Americans, make sure that if people like the insurance they have now, that they can keep what they have, make sure that we can make insurance guarantee issue, make sure that people can't be excluded for having a pre-existing condition, and generally just make this nation healthier through a prevention-focused approach.
Congresswoman Wasserman Schultz, is there anything, having just come from the leader's office, is there anything in the legislation that you expect that you'll be voting on that's new or that's different than the ideas that have already been floated?
Well, it's an ever-evolving process because we do have, a very large caucus, a lot of members that have different concerns. So I would definitely say that the bill is evolving, but we are committed to having the final product available to members 48 hours before we vote. So members will have two full days in which to review the legislation, and I feel comfortable that when we vote next week, which if I'm betting, I would bet that we would more likely than not vote next week, that we will have plenty of opportunity to get our questions in. We're going to have a 2-hour caucus on Monday with a presentation from the leadership of the committees where the bill has been marked up, and we'll have an opportunity as a caucus to ask all the questions and really get a comprehensive understanding of what's in the bill.
Congressman Wasserman Schultz, I'm joined this morning by my guest co-host Richard Wolff, who's jumping in.
Hi, Richard, how are you?
Hi, Congresswoman. I have a question about the Blue Dog Democrats, because they came out yesterday saying they didn't like the legislation as it's now formed. And there's this constant debate among Democratic activists about whether these folks get too much, whether the wishes of the majority of the party have to be tailored to a small group. Where do you think this is going to come out in terms of what the Blue Dogs are seeking in terms of costs and taxes, that kind of thing?
Well, the Blue Dogs are an important part of the Democratic caucus, and they have really strong views that have gotten us to where we are and helped us gain the majority by taking a fiscally responsible approach to governing and being deficit hawks. And they are ever mindful of the cost of health care while trying to balance quality, but we are not simply catering to one group of the caucus's needs. There are lots of different views, and we're trying to kind of mix it all up together in the chili, so to speak, and come out with a really good product for the American people that will meet our goals, which is to cover everyone in America, make sure that people can keep what they have, make sure that small businesses have the ability to be able to provide health coverage for their employees, and generally make sure that people stay healthy in America, which right now, for far too many people, is not an assurance at all.
Congresswoman Wasserman Schultz, Florida is often at the cutting edge politically and otherwise, and we know that one of next year's big battles will be the Senate race there in Florida, where your current governor, Republican Governor Charlie Crist, is running. Former Speaker of the State House, Marco Rubio, is running as Republican. One of your colleagues in Congress, the Democrat Kendrick Meek, is running. Give us a little bit of perspective. What are you hearing? Florida is so often a bellwether presidentially and otherwise. What are you hearing about that race?
Well, we had a massive opportunity politically for Democrats to make some significant gains in the state of Florida after President Obama won Florida's electoral votes in November. We now have 660,000 more registered Democrats in Florida than Republicans. We actually have been out registering continually since November, the Republicans, and we've out fundraised them at the state party level for the first time in over a decade. So the momentum is going our way. We have every major statewide office except for one U.S. Senate seat open in Florida, so the opportunity for Democrats to make significant gains is fantastic. Alex Sink, our CFO, elected statewide, is running for governor. Kendrick Meek is doing amazingly well as a Democrat, likely Democratic nominee for the U.S. Senate. And I think we're going to continue to turn Florida the brilliant blue that President Obama started in November.
Congressman Wasserman Schultz, as we head out, you were in the newspapers today. The rumor has it that despite being at a cast, you found your way over, hurting your leg, you found your way over to the pedicure stand. Any comment on that?
Well, I've got a hot pink cast, Carlos, and I put little breast cancer ribbons on my big toes because while I'm mending, I'm all about raising awareness about breast cancer and making sure that young women stay healthy and are aware that they should pay attention to their breast health. So figured while I'm healing, I might as well promote the cause.
I like that. I like that. You have a full public servant. I like that.
Exactly.
A complete public servant. Really good to see you. Have a terrific week and look forward to having you on again.
Thanks to you both. Take care.
Thank you.